we're going to do a little bit of the adapter using that.
Yeah.
Okay, and then because I don't need so much all the other things that I've been doing, but but that's the most important thing.
Yes.
I'm going to use an MP100, which was originally designed for treating kidney stones and modified for soft tissue. It gives out shock waves, and those shock waves. It's a bit like when you have shock waves, the thermostatic pressure of the shock waves creates heat in the water molecules in the joints, and it's that has the repair mechanism that aids and reduces the amount of pain that normally people experience. So we're just going to start with that. You okay with that? Yeah. You can see it's going red, so that's increasing blood flow to the surface. What I'm using right there is a piece of equipment called a PAM. Well, it stands for Power Assistant Micro Manipulator, and it helps and facilitates mobilisation in the spine. And it's got 3 modes of function. I tend to use mostly 2 for my needs. One is it's a really rapid motion, and that overrides any spasms in the spine. And the other one is it helps to normalise neurological reflexes. The machine's been around for about 30 years. It's a very useful piece of equipment, and this is how it functions. Most patients really like it. Not all, but most. As I said, it works in very rapid motion, hitting, well, kind of percussion on the transverse processes. It's normally a very pleasant experience. And you can see it raising, making it redder. It's an overall relaxing sensation. It's really, really nice, very pleasant. And any pain there, it seems to override it. How's your feeling with this, David?
Well, the first time you used it on me.
Yeah. You're surprised?
Yeah, it's in certain areas it's kind of like it tickles a little bit.
Okay.
It's massaging.
Now I'm going to use it. This mobilises. You can use it very, very powerful. You have to hold it down. It's so strong, and that's focusing on the problem. How's that, David?
It's absolutely fine.
Yeah.
There's no pain, it doesn't hurt. I can feel pressure. That's it.
This is the Nimetron Edit. Okay. This time I've got 2 machines. I'm using them in conjunction. Well, this helps to reduce inflammation, and it also diminishes pain, and it has a kind of overall relaxing effect on the patient. It dilates the blood vessels, and those 2 frequencies, look, the endo-san and the endo-dim work on, one is anti-inflammatory and the other one is a pain inhibitor, or diminishes pain overall. And most patients do like this. This is really nice, and it's really relaxing. So I normally do it for, you can do it for 5 or 8 or 10 minutes. It doesn't really, it's really a good thing to do.
Right now I'm feeling really relaxed. With this machine, I can feel the pressure of the suction cup, so it's like getting a cuddle. But it's it's got electric going through it, so it feels like pins and needles, and it's going from between two cups, and it's like a very, very deep massage. So a normal massage would be external. This is like it's internal, and it's not unpleasant. It's just like pins and needles with a little bit of pressure. So this machine has really helped me a lot.
These are just suction rings, and they go away. Okay, they do go away. Okay, and well, the next technique I'm going to show is actually, it appears to be a very unprofessional technique to do, but it's the most professional technique I know. On L5, S1, L5 is here and S1 is here, and this is the sacrum. So I put my body weight through my heel on the sacrum, and I slide that way. That causes traction as the patient pushes up with their stomach, like so. And that opens the joint, and that gives me access to the bulged disc. It's a very simple technique, but it's highly effective. Okay, push up and relax. Push up and relax. And the patient tends to stand up, and they're much lighter, and they feel much relief in the disc bulge.
Light-headed. It's good. It's really, really good. You're light-headed. Look, right now I could float away.
I'm treating the left side is where the lesions are, where the this technique dates back to the 30s, and it's what we call a Friat technique. And it's called a two-man because it used to be two men. You can do it, normally it's done with two men, but I have these straps that the patient puts their hand in, and that isolates the shoulder. I raise the couch, and I bring the legs, and it adjusts as it did. How's that feel?
Brilliant.
Yeah, good. Okay, so there you go. Treatment 2 prolapsed disc.
So I've just finished my treatment with one, as you can see. Been in bed for 2 weeks with sciatica. Couldn't walk. Been on crutches. And this is what that man's done for me.